Hey guys, this is Chinka, volunteer at Jitendra Foundation, and today we have Dr. Anjali volunteering for us. So we are gonna take this session on anesthesia. I would like Dr. Anjali to introduce herself briefly to you.
Hello. Uh, Thanks for having me. This is Dr. Anjali, working as a postgraduate student in Hindu Rao Hospital, New Delhi. As far as I am concerned with anesthesia, and as far as I am dealing with anesthesia on a daily basis, so I would like to give some suggestions for the public, for the layman's, to follow specific instructions which are given by their doctors.
Thank you. So first, we would want to thank you, Dr. Anjali, for taking out time for volunteering for us. And just to explain you a bit about the session, so since you are an expert in the industry, I mean, for us, you are already an expert. So we just want to understand there are certain myths, certain confusions regarding this topic in the general public. So the session is going to focus more on those things, and yeah, I mean, we'll try to make it more interactive and more informative for our viewers. So yeah, the first question that we have for you is, what are some of the myths, or what are some of the confusions people you had been dealing with a lot of people we know, and आपको एज पर यू व्हाट डू यू थिंक कि क्या लोगों के अंदर मिसकंसेप्शंस होते हैं या कंफ्यूजन होते हैं या डर होता है लोगों के अंदर एनेस्थीसिया का, या क्या चीज़ें आपको लगता है कि कॉमन मिसकंसेप्शंस है या कंफ्यूजन है, और उसके ऊपर व्हाट डू यू वांट टू सजेस्ट टू पीपल लाइक मी और पीपल लाइक अस.
Okay. So I'll start with the awareness. Actually, there are many people who don't even know about anesthesia or their anesthesiologist. I meet many people when I ask them what kind of surgery they had in their past and what kind of anesthesia they were given. So they know about the surgeries and their surgeons, but they don't know about the anesthesia technique they were given. So it is very important because as far as your health is concerned, so it should be your decision finally. So you should be given the choice between anesthesia techniques. So it depends on your preference as well, and it depends on our preference. Being an anesthesiologist, we can give you some choices, like if you want to go with that.
But
So
I would interrupt you here.
first of all,
For example, you said choices. तो एज अ पेशेंट अगर मैं जा रही हूँ, क्या मेरे पास चॉइस होती है डॉक्टर को कुछ बोलने की कि दिस टाइप ऑफ एनेस्थीसिया, आई वी अंडरस्टैंड, आई मीन जनरल पब्लिक की नॉलेज से वी डू अंडरस्टैंड कि डिफरेंट ट्रीटमेंट्स होते हैं, डिफरेंट टाइप्स ऑफ एनेस्थीसिया होते हैं, आप डिफरेंट टेक्निक्स होती है एनेस्थीसिया की. बट देन मेरा
yeah, for that, you should have a basic, very basic, minimal knowledge of the types of anesthesia. Like there are many types. I'll start with the regional anesthesia. So regional anesthesia में होता है कि हम एक बॉडी का एक हिस्सा, लाइक कमर के नीचे का हिस्सा हम लोग सुन कर सकते हैं, और एक बॉडी का पार्ट, जैसे अगर हमें अपर लिम्ब सर्जरी करना है, आर्म का सर्जरी करना है, तो हम सिर्फ आर्म वाला एरिया सुन कर सकते हैं. लेकिन एक होता है जिसमें हम कंप्लीट बेहोश करते हैं पेशेंट को. तो अगर हमें बेहोश करना है तो उसके भी अलग रिस्क फैक्टर्स होंगे, और हमें अगर सुन करना है तो उसके अलग रिस्क फैक्टर्स होंगे. तो वो रिस्क फैक्टर्स, एडवांटेजेस, डिसएडवांटेजेस, वी ऑल एक्सप्लेन टू द पेशेंट.
ओके.
So all the risk factors, all the advantages, all the disadvantages are being explained to you. Then you can decide on the basis of your safety, on the basis of your choice. So you can decide, and then we can go according to that. And then if you are dealing with certain medical conditions already, like you are on some treatment for diabetes, for hypertension, and there should be some changes you should make before coming for anesthesia, for coming for surgery as well. Like there can be some change in medications, there can be some change in lifestyle modifications, and you can also try to get surgery as soon as possible. So if it is an emergency surgery, then also there are certain risk factors that you should be aware of. Then if it is an elective surgeries like gallbladder removal, like stone removal,
Right.
although it is an emergency for the patient, but it is our concern so that the patient doesn't go through complications. So we plan according to the patient's condition. So before coming for anesthesia or before coming for surgery, so we will instruct and you should follow those instructions uh, for your own benefit.
और इसमें एक क्वेश्चन आता है कि यू एक्सप्लेन कि डिफरेंट टाइप्स ऑफ टेक्निक्स होती है एनेस्थीसिया के, राइट? सो यू कैन
Yeah.
हैव मतलब डिपेंडिंग अपॉन व्हाट सर्जरी यू आर अंडर गोइंग, यू हैव डिफरेंट टेक्निक्स. आई थिंक you guys have different techniques which you
Yeah.
prefer for giving anesthesia, and then accordingly you said there are different risks and different effects that occur. तो कुछ ऐसे रिस्क या इफेक्ट्स या कोई साइड इफेक्ट्स ऐसे कॉमन, यू नो, मे बी यू आर डीलिंग विद लॉट ऑफ पेशेंट्स, तो यू कम अक्रॉस ऐसा कुछ होता है और यू नो पेशेंट्स की गलती से ऐसा कुछ हो जाता है विच वी हैव टू कीप इन माइंड?
See, you have to be honest with your doctor. You can lie to anyone else in the world, but you cannot lie to your doctor, and you should not lie to your doctor. So, if even if you have taken certain medications which you are hiding, and even if you are a drug addict, if you are consuming alcohol, if you are smoking the night before surgeries, then they all can lead to certain complications. And there is no anesthesia which doesn't come with risk factors, but it depends. It totally depends. And it depends on the surgery, it depends on the patient's condition, it depends on the age of the patient. अगर elderly patient है already more than 60 years 70 years, they already have so many comorbid conditions like hypertension, diabetes, so obviously they have more risk towards anesthesia, but that can be controlled if the patient cooperates well, if the patient follows the instructions well, then they all can be dealt with. But I would not say that there are no risk factors or there's no complications of anesthesia. Every anesthesia technique comes with every anesthetic technique comes with certain kind of risk factors and complications. So, considering the patient's benefits, like the patient's maximum benefit, then we decide which anesthesia technique is best for the patient.
ओके. सो एक क्वेश्चन और विच आई हैव इन माई माइंड इज़ दैट किसी को अगर एनेस्थीसिया मिला है, राइट, उसका what is the maximum, of course, I mean he's undergoing some surgery and all and he's back, let's say, you know, a person or a patient is back to his place or to his home, तो कुछ ऐसी चीज़ें हैं that we have to, I mean of course apart from the surgery that he has undergone, but are there any anesthesia related things also that we have to keep in mind? अगर कोई बंदा recently surgery होके घर आया है and he had been given anesthesia, कुछ ऐसा होता है?
Yeah, sure. Because it depends on the duration of anesthesia. So if we are anesthetizing certain part of the body, so it will take time to recover. So at that time, the patient should not panic that the limbs are not moving, he's not able to lift his arm, he's not able to lift his legs. So it will take time to wean off. And for those kind of anesthesias, we keep the patient in monitoring. We do not send the patient until we are sure of ourselves that the maximum side effect or maximum complication which can occur, we do not discharge the patient till then. So we wait for the anesthesia to relieve. When it is completely gone, then only we can discharge the patient. And there are certain surgeries on for which we discharge the patient on the same day. keeping in mind that if any complication, if any, occurs, then the patient can come to us very in the shortest period of time. Like if he lives nearby, then we can discharge. If he has a adult caretaker at home, if he has transport facilities available, good transport facilities available nearby, and if he can is if he is well educated to understand the risk factors and complications, and so yeah, on the basis of that, we can take that decision whether to discharge the patient on time or not. So, post anesthesia, the things that we instruct the patients, we already document those, and we give verbal instructions also to the patients. So they have to follow, like they have to keep nil per oral. Nil per oral means that they don't have to eat anything until the complete effect of anesthesia is gone, especially in case of general anesthesia.
And is there any restriction with the water as well?
Yeah, actually, we are not sure whether the anesthesia effect will be completely there or not, because I said no, there is no rule that this anesthesia will be best for this patient. We decide, we basically have that idea in our mind. If any complication, if in case occurs, then we have to be prepared for that also. So अगर हमने किसी पेशेंट को बोला है कि यू डोंट हैव टू ईट फॉर 8 आवर्स, तो 8 आवर्स तक पेशेंट को कुछ नहीं खाना है, और लिक्विड्स के लिए भी स्पेसिफिक इंस्ट्रक्शंस दिए जाते हैं कि आपको कितना आवर्स पहले तक लिक्विड लेना है, कितना आवर्स के पहले तक लिक्विड्स नहीं लेना है. देन this happens before surgery and post surgery also. So post surgery भी there are instructions and before surgery.
I think we got what we actually were looking for. So basically, the society awareness for anesthesia. इसके अलावा do you have any particular thing that you would want to share with the society? For example, I mean, we do understand that anybody going through this procedure, they have to be, of course, very well educated. Um, and how do they do that? Basically, they have to talk to the doctor. They have to make sure that the doctor explains everything to them, and they can ask questions. But then eventually, कुछ anything that you would want to share कि लोगों के which you see in day to day life, कि लोगों के कुछ ऐसी चीज़ें या गलतियाँ या the mistakes that people usually do repeat, और ऐसा कुछ if you want to share for the general public.
Yeah. What happens? There are patients, which I talk about, that they hide their medical conditions.
Okay.
Some patients forget to tell actually to the doctor. So it is our concern that we ask for all the information. In spite of that, they do not give us the complete information. So first of all, you have to trust your doctor. So if you do not trust and you hide things, then it will be a problem for you as well and for us as well. So if we already know the medical conditions, if we already know that the patient has been given anesthesia previously, so it makes it is easier for us. So if the patient has undergone surgery before, so there are chances that he will tolerate the procedure well this time also. So, and talking about the precautions that patients should take, like most commonly smoking. People refuse to stop smoking before surgery, actually, because they cannot control the urge to smoke. So it is very important that they should stop smoking and they should stop alcohol before surgeries, because it can cause a lot of problem for the patients, because if we have to give general anesthesia, then smoking causes reactive airway, so which is hard to manage. But obviously we are anesthesiologists, so we will take care of that, but but it's better to avoid. It's better to take precautions than to cure.
Thank you, Dr. Anjali. I think it had been an interactive session, and we really gain insights about anesthesia and basically about if somebody around us is undergoing any procedure like this. So, at least, the next time we'll be more aware. We would uh, be wondering what kind of anesthesia is he going under, and we'd be more concerned. We can actually let him know that he has to talk to his doctor properly, understand the procedure, and follow whatever the doctor is suggesting. तो इतनी भी आई थिंक अवेयरनेस बढ़ती है दैट्स काइंड ऑफ गुड फॉर द सोसाइटी वी थैंक यू फॉर योर टाइम हियर एंड we wish you all the best with whatsoever you are doing, helping and healing lives. And yeah, thank you for joining Jitendra Foundation.
Thank you so much.